Understanding coma, a journey back to consciousness. This journey is often fraught with uncertainty and hope, as the path to recovery can be unpredictable and varied. A coma is a state of profound unconsciousness. It is not simply a deep sleep, but a critical medical condition. It's a critical medical condition where a person shows no signs of awareness. The individual is unresponsive to their surroundings. They don't respond to their environment, sounds, or pain. This lack of response is a key indicator of the severity of their condition. This unresponsive state results from severe brain injury or dysfunction. The brain's normal activities are disrupted, leading to this profound state of unconsciousness. Imagine a person sleeping so deeply that they cannot be awakened. This analogy helps to understand the depth of unresponsiveness in a coma. This prolonged state of unresponsiveness characterizes a coma. It is a state where the brain's higher functions are significantly impaired. The brain, responsible for our thoughts, movements, and senses, becomes inactive. This inactivity affects the entire body, leading to a lack of voluntary actions. This inactivity leads to the absence of outward responses that we typically associate with consciousness. The person appears to be in a deep, unending sleep. Coma disrupts the intricate workings of the brain, leading to a profound lack of awareness and responsiveness. The brain's complex networks are unable to function normally. This state can arise from various causes, each impacting the brain differently. Understanding these causes is crucial for treatment and prognosis. Traumatic brain injuries, for instance, can result from a severe blow to the head, disrupting normal brain activity. These injuries are often sudden and unexpected. On the other hand, conditions like stroke, where blood flow to the brain is interrupted, can also lead to coma. The lack of oxygen and nutrients causes brain cells to die. Other potential triggers include brain infections, which cause inflammation and swelling, and prolonged seizures, which disrupt the brain's electrical activity. Each of these conditions poses unique challenges. The duration of a coma is unpredictable and varies significantly depending on the severity of the injury and individual factors. Some may recover quickly, while others face a long road ahead. Some individuals may emerge from a coma within days or weeks, while others might remain in this state for months or even years. The timeline is often uncertain and can be emotionally taxing for families. The journey back to consciousness is often gradual and marked by different stages of recovery. Each stage represents a small but significant step towards regaining awareness. As the brain begins to heal, individuals may transition from a coma to a vegetative state. This state is a sign of progress, though it still lacks full consciousness. This state is characterized by the return of sleep-wake cycles and basic reflexes, but without signs of awareness. The person may open their eyes and have periods of wakefulness. Further recovery may lead to a minimally conscious state, where individuals exhibit inconsistent but discernible signs of awareness. They may respond to simple commands or show emotional reactions. The impact of a coma extends far beyond the individual, affecting families and loved ones who face uncertainty and emotional turmoil. The waiting and hoping can be an emotional roller coaster. The lack of knowing when or if their loved one will wake up can be emotionally draining. Families often cling to small signs of progress, hoping for a miracle. The challenges of caring for someone in a coma, including medical decisions and potential long-term care needs, add another layer of complexity. Families must navigate these difficult choices with care and compassion. Throughout this challenging journey, hope remains a constant companion, fueled by medical advancements and the unwavering belief in the brain's remarkable ability to heal. The resilience of the human spirit and the support of loved ones play a crucial role in the recovery process. Coma arousal therapy, also known as coma stimulation therapy, offers a beacon of hope for individuals in this unresponsive state. This innovative approach is designed to engage the brain in a way that encourages the reawakening of consciousness, providing a lifeline to those who seem lost in the depths of a coma. This specialized treatment aims to stimulate the brain and promote recovery of consciousness. By using various techniques and tools, healthcare professionals work meticulously to create an environment that fosters brain activity and responsiveness. The core principle of CAT lies in the idea that providing sensory stimulation can help awaken the brain. This stimulation can come in many forms, such as auditory, visual, tactile, and olfactory inputs, all carefully selected to provoke a response from the patient. It is like nudging the brain gently, reminding it of the outside world. Simple actions, like touching a patient's hand or using specific sensory tools, can make a significant difference in the patient's journey towards recovery. CAT involves a multidisciplinary approach, with skilled healthcare professionals working together to deliver individualized treatment plans. This collaborative effort ensures that every aspect of the patient's needs is addressed, from medical care to emotional support. This team includes physicians, nurses, physiotherapists, occupational therapists, speech-language pathologists, and neuropsychologists. Each member brings their unique expertise to the table, creating a comprehensive care plan tailored to the patient's specific condition. Each discipline plays a crucial role in maximizing the patient's potential for recovery. The synergy between these professionals is what makes CAT so effective, as they work in unison to stimulate the brain and support the patient's overall well-being. Physicians, often neurologists specializing in brain disorders, oversee the patient's overall medical management. They ensure that the patient receives the appropriate medical interventions and monitor progress closely. Nurses provide round-the-clock care, monitoring vital signs and administering medications. Their constant presence and vigilance are crucial in maintaining the patient's stability and comfort. Physiotherapists in CAT focus on improving motor function, preventing complications, and promoting physical recovery. They work on exercises and movements that help maintain muscle tone and prevent atrophy. They use a variety of techniques, such as passive range of motion exercises, positioning, and early mobilization, to maintain muscle integrity and prevent contractures. These activities are essential in keeping the patient's body ready for eventual recovery. Occupational therapists, on the other hand, concentrate on enhancing the patient's functional independence. They work on skills that are necessary for daily living, helping patients regain their ability to perform everyday tasks. They address activities of daily living, such as eating, dressing, and bathing, using adaptive strategies and assistive devices. These interventions are crucial for improving the patient's quality of life and fostering independence. Speech-language pathologists play a vital role in assessing and stimulating communication and swallowing functions. They work on exercises and techniques that help patients regain their ability to speak and swallow safely. They employ various techniques to improve speech, language comprehension, and safe swallowing abilities. These skills are essential for the patient's overall recovery and reintegration into daily life. Neuropsychologists contribute to the team by assessing cognitive function. They evaluate the patient's memory, attention, and problem-solving abilities, which are critical for understanding the extent of brain injury and planning appropriate interventions. They design interventions to address attention, memory, and problem-solving skills. These cognitive therapies are tailored to help the patient regain mental functions and improve their ability to interact with their environment. CAT is not merely a set of procedures. It's a testament to the unwavering belief in the brain's potential to heal. It embodies the hope and determination of both the healthcare team and the patient's loved ones, who believe in the possibility of recovery against all odds. It is a journey of perseverance, compassion, and hope, reminding us that even in the darkest of times, the possibility of awakening remains. This journey is a powerful reminder of the resilience of the human spirit and the incredible potential for recovery that lies within each patient. Physiotherapists play a critical role in the CAT team, acting as guides on the patient's journey toward recovery. Their involvement is not just limited to physical rehabilitation, but extends to emotional and psychological support, ensuring a holistic approach to patient care. Their expertise in movement and function is essential in addressing the unique challenges faced by individuals in a coma. They meticulously assess each patient's condition and tailor their interventions to meet specific needs, ensuring that every movement is purposeful and beneficial. One of the primary goals of physiotherapy in CAT is to prevent secondary complications that can arise from prolonged immobility. These complications can include muscle atrophy, joint stiffness, and the development of pressure sores, all of which can significantly impede the recovery process. When a person is in a coma, their muscles are not being used regularly, leading to muscle weakness, joint stiffness, and contractures. This lack of movement can also affect circulation, leading to further health issues. These complications can further hinder recovery and make it difficult for the individual to regain independence once they emerge from the coma. Therefore, early and consistent physiotherapy is crucial in mitigating these risks and promoting a smoother recovery process. To combat these complications, physiotherapists implement a range of interventions. These interventions are carefully designed to address the specific needs of each patient, ensuring that they receive the most effective care possible. Passive range of motion exercises involve gently moving the patient's limbs through their full range of movement. This not only helps to maintain joint flexibility, but also stimulates the muscles and nerves, promoting overall physical health. This helps to maintain joint flexibility and prevent contractures, ensuring that the joints remain mobile. Regular movement is essential in preventing the joints from becoming stiff and immobile, which can be a significant barrier to recovery. Positioning is another important aspect of physiotherapy in CAT. Proper positioning can help to prevent pressure sores and improve overall comfort for the patient. Patients are carefully positioned in bed to prevent pressure sores, also known as bed sores, which can develop from prolonged pressure on certain areas of the body. This is particularly important for patients who are unable to move themselves. By regularly changing the patient's position, physiotherapists ensure that no single area endures excessive pressure, reducing the risk of these painful sores. This regular repositioning is a key component of comprehensive patient care. Early mobilization is a key principle in CAT and a cornerstone of physiotherapy intervention. It involves getting the patient moving as soon as it is medically safe to do so, which can significantly enhance the recovery process. This involves getting the patient moving as soon as medically appropriate, even if it's just sitting at the edge of the bed or taking a few steps with assistance. These small movements can have a big impact on the patient's overall recovery. Early mobilization not only helps to prevent physical complications, but also provides sensory stimulation to the brain. This stimulation is crucial in helping to wake the brain from its state of unconsciousness. These movements, even when performed passively with the help of therapists, can help to rouse the brain from its state of unconsciousness. This is a critical step in the recovery process, as it can help to improve the patient's overall cognitive function. By addressing physical complications and promoting sensory stimulation, physiotherapists contribute significantly to the patient's overall well-being and potential for recovery. Their work is essential in ensuring that patients have the best possible chance of regaining their independence. Their dedication and specialized skills make them invaluable members of the CAT team, guiding patients towards a brighter future. Through their efforts, patients are given the support and care they need to navigate the challenging journey of recovery.